So it's been a wonderful day. We've just gone through some of the latest treatments. We've been talking about some of the how to get better information. We've been talking about some of the newest and potentially most breakthrough opportunities in research. So there are a lot of things that are themes that we will be able to answer your questions on in the last hour. But I remembered a couple things Dr. Visser said. He used the term long-term survival, and then he said, no two patients' treatments will be the same. And as we've been saying all day long, this is a journey. Many of you shared how long your journey has been earlier. And the key thing is to live it not only with grace, but also with power and empowerment and full of the kind of vitality you can have when you've got the kinds of expertise, information, treatment, and other strategies. And that's what this panel is really all about. And we have a terrific, terrific panel who I've gotten to meet a little bit on the phone and have a lot to share with you. So we're going to start off with a patient perspective that is much more than a patient perspective to set the stage, because we are truly grateful to have one of the real key players in the NET community with us here today, who's not only a patient, but someone who really showed the leadership and vision to help to form one of the key organizations in this space, which is the NANETS, the North American Neuroendocrine Tumor Society. So it is with great pleasure I introduce Carrie Brentro to start this panel off. Carrie?
Thank you. Normally I do this talk in about 25 minutes and they've given me 5. So I'm going to try to take 22 years and put it into 5 minutes. My story starts back in 1993. And that's when I started having symptoms. And I would get these flu-like symptoms about every 6 to 8 weeks. And I'd be sick for about 3 days, and then I would start to get better, but I never quite felt right. So I would go to the doctor every so often, and they would run some tests on me. Well, after about 2 years, the doctors had finally thought that it was basically in my head and I was depressed. Well, I probably was. I had been sick for 2 years. And so she decided to give me depression medicine. So she puts me on depression medicine, and I was going to be going on vacation, and you couldn't have alcohol with the depression medicine. So I said, well, I'm going to be drinking on my vacation, so I'm not starting it until I get back. So I started on the medicine, and I wasn't even on it for a month, and I got another bout of sickness. Well, this time I didn't get better. And so after about 4 days, my husband says, I think you better get into the doctor. Well, I went into the doctor and went in for emergency appendectomy. And I was sick for about 3 days in the hospital. My blood pressure would come up, so they finally let me go home. And on Monday, both my girls had come home from school, and one was in 3rd grade and one was in 6th grade, and I was laying in bed, and the phone rang. And it was the surgeon, and I didn't even remember his name. And my oldest daughter had answered the phone, and she says, it's Dr. So-and-so. I get on the phone, he goes, you have cancer. And I was just like, okay, what kind? And he said, carcinoid. Well, I had never heard of that. So I go downstairs and I said to my husband, I've got cancer. So remember, this was 20 years ago. So I look it up, 5-year survival. And I'm thinking, I'm never going to see my girls graduate from high school, get married. It was the worst week of my life. But when I finally got to a medical oncologist, he says, don't worry, the size and location of your tumor, you're basically cured. We just need to follow you once a year. So I closed the book on that disease and went back every year for my tests. Well, after about 3 years, I started having symptoms again. Well, in the doctor's mind, I was cured, which I know George doesn't like that word, and neither do I. So they started treating me for GERD. And they treated me for 5 years. Luckily, I did have a medical oncologist who would not quit doing my yearly tests at 5 years. He decided I needed to keep doing them. And statistics do show that midgut carcinoids do, if they're going to come back, they usually come back in 7 to 9 years. So at my 7 years, they said, it's back. I went through about $60,000 worth of tests. Every orifice of my body was probed at least once. And they finally figured out that it was, my liver is peppered with tumors. So at that point, I said, I better start educating myself on this disease. So I found out that 90% of doctors don't know what they're, 90% of patients are misdiagnosed. 90% of doctors don't know what they're doing. They believed that it did not metastasize, and I was told like I was a 1 in a million with where mine was located, and that didn't shock me. I'd told my husband that for years. So I decided that, you know, I needed to educate myself. So the first thing I did was I went to the patient conference in Philadelphia in 2005, and being the A personality that I am, I just decided, well, I'm going to help coordinate the one for next year, and we'll do it in Portland, Oregon. So as I was doing that, I found out that we'd been educating patients since 1999, but there had never been a comprehensive medical education program for physicians. No wonder there was a 90% misdiagnosis rate, right? And so during that, we were bringing in all these top doctors from all over the world, and I've got 45 seconds left. So we put together the first continuing medical education program in Portland, Oregon in 2006, and at that time, as I was putting that continuing medical education program together, I was asking why we didn't have a professional society like they did in other countries. And they said, well, we've been talking about it for 7 years, you know, but nobody will organize it. I said, okay, well, if I write the bylaws, design the logo, are you guys in? And they said, sure. So I went and I wrote the bylaws, and I did a small meeting at ASCO, and we reviewed them with a small group of doctors, and they agreed to form the society. So on September 28th, 2006 in Portland, we adopted our bylaws, elected our officers, and Nanette's was born. I did have to fill out 28 pages of IRS forms to get our 501c3 status, which that was approved on February 21st of 2007. So since that time, we have put on we're organizing our 8th international conference this year in Austin, Texas. We've put on 11 regional conferences. We've done 2 sets of guidelines, and I couldn't be more proud of the doctors that I work with. They are some of the best people as well as smart minds that I could ever put myself around. And 3 of them are sitting right here in this room that are on my board or executive committee. So now is the 4th chapter of my life, and I want to say that I started on a somatostatin analog 14 years ago. As far as I know, my little buddies have stayed little buddies in my liver, and I, at this point, do not have any progression. I did want to talk a little bit about some of these other things, but I don't have time. So, no, what works for you? I just wanted to give you a couple tips of how to kind of live with this disease. I know it's really shocking when you find out you have cancer, then you find out it's a rare form of cancer, then you find out most doctors don't know what they're doing. And the first thing you want to do is get on the internet. Well, 20 years ago, there wasn't a lot of information. Now there's gobs of information, but I find that in my support group, so many patients, especially when they're first diagnosed, they get on and they're living on the internet. Don't do that. Your brain can only take so much, and this is like learning a different language. Think of all the acronyms we use: PRRT, SSA, CT, PFS. I mean, you're having to learn a different language, and your brain can only absorb so much at one time. So try to set a timer and spend a little bit of time getting some education, and then go out and live your life. It's okay to ask for help. Many of you are probably A personalities like me, and I want to do it all myself, but it's okay to ask for help. I've run a support group since 2005, and I think that that's one of the best things you can do. You need to be with other people who understand what you're going through. Conferences like this keep coming, because every single conference, every single video that you watch, you will learn one thing. Remember that you're going to have to establish a new normal. When somebody asks you now, do you hurt or are you feeling okay? It's different than when you were before your disease. So kind of set that new normal and pace everything from that new normal. Know that you're gonna have to modify your life. I'm kind of like an ever-ready bunny, and I go, 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 go. But sometimes if I do that, then I have to crash for 3 days. So I have to learn to pace myself. And listen to your body. It's okay to do a siesta in the middle of the day if that's what your body tells you. And then review your goals and priorities. Family is number one. Always put them number one. They are your rock. Communicate with them and determine that if you only have a few hours of feeling good, spend it with your family, spend it with your friends. Don't spend it cleaning the house or cooking. And then organize and plan your life. You know, if you want to go out and feel normal again and go to a holiday party and have a drink or, you know, eat some food that normally gives you problems, take a rescue shot. For me, you know, I laugh a lot, I listen to music, I try to enjoy each and every day, and I know that there's gonna be days that I have bad days, but then I just keep saying, well, tomorrow's gonna be better. And anybody who really knows me knows that it's not, and in the end, it's not the years in your life that count, it's the life in your years. And I tell you, I live every day to the fullest. And I just love this last quote from Danny Kaye that says, life is a great big canvas, and you should throw all the paint on it you can. Thank you.
What a great start to the panel. And Carrie will have some more comments during the question and answer, and she'll be part of this panel as well. And thank you again, Carrie, for your leadership in terms of NANETS, as well as the example you've given us to respond to here today. So we have a variety of different kinds of disciplines to be talking about here today. Integrated medicine is next up, and Dr. Manuela Kogan and the nurse practitioner who works with her, Nicole Brown. So Dr. Kogan, are you going to be starting off? Terrific.
So I have 12.5 minutes with you to cover about 100,000 years of evolution. And to make this meaningful, I picked one aspect that I thought might be helpful in this journey you're all going through. And it's about stress. Why zebras don't get ulcers. Some of you might know the book. It's a wonderful book, The Acclaimed Guide to Stress, Stress-Related Disease and Coping. And one would think that in the process of evolution, we would have evolved into something that's helpful. If zebras don't get ulcers, how come humans do? And that's what I'm going to focus on. What is it in the acute stress response that makes your life while you're going through cancer, live with cancer, get treated from cancer so difficult? Stress. Take a moment what stress means to you. You know, stress is a buzzword. Everyone talks about it. And what is stress to you? I actually Googled it, and the first word that comes up, or the first sentence, is a state of mental or emotional strain or tension resulting from adverse or very demanding circumstances. So it's kind of a negative connotation that goes with stress. But when you look at the stress research, which is about 100 years old, the person who was very involved in that, grandfather of stress research, called it something else. His name is Hans Selye. The non-specific response of the body to any demand of change. It's very different. So there's a change, something happens in your life. It might be something horrible. In your situation, it's cancer, something challenging, a tumor. But then the body responds to it. But the response is non-specific, and that's important, as you see in a moment. What I won't emphasize much is this whole talk on positive and negative stress, acute and chronic stress. There's a whole literature out there that the positive stress you have to perform in life is something good, but as you go on, the body gets fatigued, it gets exhausted, and health eventually disintegrates and you get sick. But the book by Dr. Sapolsky that I projected up there. If anyone wants to educate themselves more about that, it does so in detail. What I want to talk about is one aspect which colloquially we call fight or flight or freeze. Because that's what happened to you when you got diagnosed. It was a shock, I assume, for most of you as you described. And in order for you to manage your stress, you need to understand the physiology of this. What is happening in your body, in your mind, when this event takes place? And I'll run through the anatomy. That's not that important, but if you get a sense of what happens inside of you, is when you can actually do something about it. So that's you on the inside. If I strip you of your bones and skin and muscles, that's how you end up looking. Brain, big fettuccine coming out the spinal cord, and some spaghetti attached to it that go to literally every organ that's between here and here. Every organ. And a schematic of it and you don't need to know the details, it's not important, but the importance is that this system runs mostly autonomically. Those nerves have a life of their own, particularly when you're stressed. And it's important that that system is in balance. It's actually split in half. That's a simplification, but for the sake of learning, the left part is an activation, the picture of that fight and flight you saw. Organs will behave differently in this fight and flight, what's called sympathetic state. Then on the right side, organs will behave differently when you're relaxed, when you rest, which is called the parasympathetic. But just think of fight and flight, or freeze for some people, and rest and relax. And physically, what happens when that system is activated, that fight and flight and freeze, is that on the right side, you see a number of symptoms that some of you might have experienced. You're not sleeping well, you're irritable, you're distracted, you can't focus, you can't think, you might have chest pressure, you can't breathe. Some of these things are subtle. Some of these things even happen outside of your awareness. You might be nauseous. You might have diarrhea. And here's the ringer. Many of these symptoms coincide either with your tumor or with your treatment, and which makes it tricky. How can you know when you have any of those symptoms? Are they due to stress, or are they due to your treatment, or are they due to your tumor? So it takes some awareness, some learning to get to know your body. So that's the physical side. There's a theory in social psychology, and anyone who took Psychology 101 in college probably heard of it. When you have a stressor, again, we're going back to this fight and flight, a car driving at you, being diagnosed with cancer, someone putting a gun to your head, what happens first? Are you stressed first, all these body symptoms I projected up? Your heart is pounding, or are you scared? Does it happen concurrently? Or, which is the third theory, and this is what I strongly believe in, the one on the right, it's not just the event that happens to you. It's not the heart that's just pounding, and it's not just the fear you feel, but it's how you label it. There's some process in your thinking going on that interprets what happens. And that's another important differentiation that I really want you to make is it is very scary what you're going through, and that's all real, but how you interpret what's going on can contribute as much stress and that fight and flight response to your body than the event itself. So the stimulation of stress response is not just about the external reality, but the meaning that you attach to it. Unfortunately, a lot of these things happen outside of your awareness. This is a book, it's very entertainingly written, beautifully written, that takes that point home, that everything I said, would be wonderful if we were aware of it. But I work a lot with patients that come and say, I just don't feel well. Yeah, of course you don't feel well. You have an illness, you get treatment for it, but sometimes you don't feel well because in addition to all the things you have to go through, you're stressed about them. And that book really impressed me with the demonstration of how often these things happen outside of your awareness. So my job and my job with you is, when we work together, is to bring that to the surface so you can even do something about it. The title of the talk is Stress Management, but we can't manage anything unless we learn what's going on first. So, incognito, the secret lives of the brain, and I say also body. We love to believe that we ride our brains, but I don't believe that's true. I actually believe the brain is riding us. And I want to demonstrate that with things you can probably relate to. You're often taught you shouldn't be stressed, relax, it's much better for your health. But many of us are in that situation. Today, I tried to think positive, but it didn't work. Many of you know you can be awake at night, you think about something you're not supposed to think about, you try not to think about it, and you think about it anyway. So I teach techniques that hopefully shorten that period at 3 o'clock in the morning and help you go back to sleep. So that's the thinking part, cognition. We're thinking and we can't stop. Very stressful for the body. Emotionally, it's not that different. She says, you worry too much. It doesn't do any good. And he says, it does. For me, 95% of the things I worry about never happen. So a lot of people worry a lot. They anticipate what's happening in the future. And we hope that we can do something in worrying so things don't happen. So the body has a life of its own. Thoughts have a life of their own. Emotions have a life of their own. So what we're supposed to do? So we can, unfortunately, find ourselves in a vicious cycle. Thought, body, emotion, all feeds on each other negatively. There's another component on there. I'll talk about it in a minute. What motivates us, what we need in terms of our core needs. You mentioned something important. We got to live. We got to live a good life. We have quality of life, and often going through an illness, we lose that quality of life. We lose our bodies temporarily, and it can be very, very challenging. And I want to illustrate that, just how complex these things feed on each other and make us crazy. So when you're diagnosed, for most of you, was a surprise. Not so much it was a long course, you were sick for a long time and people didn't catch it, but then still when the person said, oh, you have cancer, you're like, whoa, really? And it's a shock. So if you, in that moment, I said thought, how you interpret what happens to you in that moment, if the thought is why me, because you're someone who believes in fairness and justice, then that thought will be quite stressful because it's not fair that you got sick. It might make you angry, and your body is shocked anyway. And if we're angry, we don't think as well. The body is even shocked further. If we don't get fairness and justice, we even think worse thoughts. So not just is it feeding on each other, all these things are interrelated. And as I said before, it's not just the fact that you got diagnosed, but it's the thought, why me, that can drive that whole cycle. And the reason why it's important is that you then have anchors where you can actually do something about it. If you do not sleep at night because you think that stuff, or you notice that you can't tolerate the unfairness that's happening to you, those are leverages where you can actually change. If you get your surveillance scan, it's a similar example. We all want certainty. We all want predictability. Illness is very unpredictable. It's a hard thing to deal with. So your thought might be, the cancer will be back even before you get your scan. That's a thought that many of you have. In that moment, you don't have certainty. The body is stressed, and you worry. Or George might have told you you're cured. I know you don't want to say that, but I know you get always teased with that. It's hard. People do get cured from cancer, so I do want to say it, but it's difficult to live with the fear that the cancer can come back and you do not know whether or not it does come back. Or living with illness, you know, you call them your little guy, I can't remember, you called them your little guys are in Czech. Yeah, yeah. And so you might think, someone told you you're good, but you don't feel good. And you might think that you might die because you have a sense you need some safety in life, but the thought doesn't allow that. So all these things can swirl around, activate our bodies, and as I said earlier, make us crazy or at least make us stressed. So in order to change that, you need to recognize it. And if when I work with people, there's this technical term, pattern recognition. So what are your emotions like? Are you someone who is more emotional? Oh my goodness, I'm 1 minute over. Okay, I'm rushing, almost done. Can you even recognize your emotion? Are you someone who's very emotional and might need help with that? Are you someone who is up at night at 3 o'clock and thinking, scary thoughts? Are you someone who didn't get their needs met? Relationships turn sour, friends, change, something important that you need while you go through that illness. And what is your body state like? A lot of us do not notice when our bodies are stressed. And to just throw in a little complication, which is confirmation bias, most of us, even if we have the ability to recognize things, we do need to believe what we need to believe. So we have a biased view, and to get that out of the way sometimes takes a little work. There are many books. Nicole is just going to talk in a minute about the things you can do here at Stanford, or we'll make general recommendations. But there are wonderful books that address all that. Norman Deutsch wrote a book, The Brain That Changes Itself, very well written. Just published another one, The Brain's Way of Healing. And the brain can change. I said earlier, we do not write our brains, the brain writes us, but it's not totally true. We can learn to at least contribute to help write the brain. Michael Singer wrote a lovely book, Untethered Soul, for the ones that get stuck in thought patterns. It does a good job at helping you get unstuck. Then David Servan-Schreiber, he's also the guy who wrote the anti-cancer book that some of you might know, wrote a book, The Instinct to Heal, that tells you many techniques you can use to get your emotions in check, have more positive thinking, don't get stuck in your thinking, don't have your body be so stressed, and get your core needs met. Thank you.
Thank you, Dr. Kogan. As you can see, we have speakers who could easily give you a 20 to 30-minute talk. Yes?
I just have one special request that each of you introduce kind of who you are and what your role is.
Right.
I think Dr. Kogan is a psychiatrist, so just to know how they interact in your care team.
Yes, and I was about to do that, but thank you, Pam. So I didn't realize that the two speakers in this stress part of your, I'm most stressed about this, your agenda were in two different parts of the Stanford Cancer Center enterprise here. So next is Nicole Barr, who's a nurse practitioner right in the Cancer Center working in the psycho-oncology clinic. She's going to share about 5 minutes of remarks with you, and then we'll do a better job introducing the other speakers. By the way, if you haven't seen it, definitely during the poster session, we did an international survey of quality of life. I know a lot of you were looking at that, and some of the speakers will reference it in terms of issues of stress and fatigue and others. So definitely do that afterwards. Nicole?
Hi. So I don't have slides, so we'll keep that up there. So I am a nurse practitioner, and I'm also a marriage and family therapist intern. And Manuela has been one of my mentors, and we work in slightly different areas. She works in integrative medicine as a psychiatrist, and I work in the Cancer Center coordinating a new psycho-oncology clinic that we have. So I think I'm just to take 5 minutes and I think build on what our speakers have already said. I think that the question becomes, how do you deal with this stressor in life and go forward with a minimum amount of suffering, part of which is, responsive and happens within the brain and with what we think. And there's so many modalities, and it strikes me that a lot of patients who come to see me have gotten a lot of advice. You should try this, or you should try that, you should try cognitive therapy, you should try mindfulness, you should try vitamins. And it's sometimes hard to sift through all that information. And Manuela and I were talking beforehand, before this, about how individual stress management is for each person, and that what can be helpful is, as you're looking at your treatment or your survivorship or whatever phase of the, sometimes very long journey you're on, is to sit down with somebody and kind of come up with your own stress management plan, because different things work for different people. So I do, certain interventions like mindfulness-based stress reduction or mindfulness techniques. Sometimes that works for people. Sometimes it's like you throw spaghetti at the wall. Some people say that doesn't work for me at all. And something else might work, prayer, or just realizing that getting along better with your partner is going to really reduce a lot of stress. And because I'm both a family nurse practitioner and a family therapist, I always think of people in the context of their family, and sometimes a lot of distress just comes from the impact on relationships of having an illness. I have a surprising number of patients who come to me and say, I'm not worried for myself, I'm worried for my partner, or I'm worried for my children. And sometimes that can be a very important part of stress management for people. The other thing I just want to say very quickly is that there's sometimes a stigma with seeking help. So you think, how do you get stress management help? At least at Stanford, sometimes it means seeing a counselor, seeing a therapist, seeing a psychiatrist. People get sent to my department, which is very unattractively called psych oncology. And sometimes that blow is softened a little bit by the fact that I'm a nurse practitioner, and that sometimes people prefer that to seeing a psychiatrist. Sorry, Manuela. Manuela is an integrative medicine. So there's a lot of barriers to getting to that kind of care, and some of the barriers are stigma, the stigma of feeling like, why do I need to see somebody for this kind of help? And I think that one thing I want to emphasize, and I think that Carrie, your talk spoke to this, is that having symptoms of depression or anxiety in the context of a cancer diagnosis is not psychopathology. It doesn't mean you're crazy. It's actually really natural and entirely normal to have the stress response, to have a lot of fear or anxiety or anger at how things have gone. And so it doesn't mean that there's something wrong with a person. It's actually just a really normal part of what happens for people when they get a diagnosis. And the other thing is that I think a lot of people have been told they were depressed or anxious as they were getting diagnosed for their tumor, particularly rarer tumors, and so have some bad feelings about, no, I'm not depressed, I'm tired because something's going on in my body. And sometimes it's hard for people to then shift back into seeking help from the same professionals or in the same category of professionals where you were sent during a course of misdiagnosis. Does that make sense? And I see some people sort of nodding. And so I think that's just something to try to work with your team on how to get the help you need without the stigma of that kind of help or the piece of it that happened in the past getting in the way, because it can be very helpful to come up with an individualized stress management plan with somebody who sort of deals with that piece of care. I have a number of books also that I recommend to people that are very helpful, but I think I'll be around for the panel afterwards, and I'm available if anybody wants to give me their email. I can send a list of books rather than go into it now, because I don't have any nice pictures of their covers to share. So I think I'll wrap up there and we'll move on. Thank you.
This is such an important set of conversations that I can almost see us doing a half-day program on these kind of therapies, so lessons for the future. So we're now going to talk about something a little different. Misha Cohen is a research specialist of integrative medicine. I think she sits with Josh, or has sat with Josh, on the board of the Society for Integrative Oncology. And she's going to talk about mixing and combining Eastern and Western thoughts and therapies and how she does it in her clinic here in San Francisco. Misha?
Hi there. I'm so glad to be here. And I This is the first time that I have been at this conference, and it's really wonderful to meet all of you and to have been invited to participate. I have a long history of working with people with complex diseases and many people with cancer and support over the last 40 years. And it's something that humbles me every single day. And I really think about how can people and how can you manage all of the information, all of the things that come forward to you? And we've heard a lot about that today. And I think that so much has been talked about that's really important about trying to focus and to stay centered, work with stress, and not to take too much information in at any given time. You know, so that's one place I wanted to start. I also wanted to talk about how, I'm not specifically going to be talking about Chinese medicine or exactly how Chinese medicine works, but I really want to talk about how to engage your medical team in your whole care, which is how would you be able to integrate medicines together in a kind of a, this is like a 10,000 foot level that I'm going to be speaking at today. So here's the agenda. Now, this could also be an all-day conference in this agenda, and you'll have these slides later to take a look at. Basically, the integration of Eastern and Western medicine and cancer care and support really can help you as a person who's been diagnosed with cancer to sustain yourself. It can make a big difference, I think, in your care. At times in this talk, I'm going to use my clinic as an example. However, these concepts can be universally applied. And what I want you to get from this talk is these are the kinds of questions and issues that you want to address if you are seeking integrative medicine care, whether it's with an integrative oncologist, whether it's with a Chinese medicine practitioner, or any other type of practitioner. And that's what I'd like to have you get from this talk. So people who are living with complex health conditions such as NET often, as you know, require a lot of careful monitoring. Often you're going through ongoing treatment, and this is of course going to include Western diagnostics, it's going to include Western treatment, it's going to include, but a lot of different things. However, it can also include Chinese medical diagnosis, Chinese medical treatment, as well as many other types of what we call mind, body, spirit support. In Chinese medicine, we do not separate mind from body from spirit. All aspects are one, and when we treat one aspect, we're treating the other. So when we're talking about stress, we're talking about when we work to de-stress, when we work with that aspect, it works on the physical body as well. And so there's a lot of spiritual support, emotional support, physical support, all of it supports the whole being. And these can be certainly woven together to provide an integrative medicine care plan. So in an integrated plan, using Eastern and Western medicine together, the practitioner, the Chinese medicine practitioner, should be asking you, how are your Western treatments going? That's sort of the bottom line. He or she should also make sure that the treatment plans support and facilitate the healthcare decisions that a client, in our case, would be making with other providers. So that's a very important piece. Sometimes, I know that there's a lot of times where people will go to one practitioner, go to a different practitioner, and don't talk about what one is doing, what the other is doing. There's not a relationship there. There's not even a discussion of exactly anything other than how am I feeling today. And I believe that there really has to be a treatment plan that supports the whole process for an individual. It's best that there's frequent contact that's made by the Chinese medicine practitioner with the Western oncology team to ensure that everyone's working together. And remember when we saw slides that said team? That's really important. team is a really important aspect, whether somebody is working all together in one center or whether people are in different centers and need to communicate with each other. There still needs to be the team that person is the captain of. And you are the captain of your team. That's what I always tell my clients. You are the captain of the team. You are the one who is in the center, and you are the one who is going to be actually creating a lot of the relationships, but you also need to help that your practitioners need to be on board in terms of developing the relationships as well. Appropriate referrals need to be made as well. So if someone comes to me and needs a referral, or I see that there's something that I can't help them with, or they're not following through with their oncologist or their psychiatrist, I make sure that that referral has been made. And that's important. So what does this mean to you? Chinese medicine practitioners should be able to work in conjunction with the Western treatment team, with the Western care. All these different things, it's like a big puzzle. It has to be put together. You know, you can't just throw the puzzle on the floor and kind of pick one piece up at a time. You need to start to see that this is one puzzle, or maybe, you know, somebody took two puzzles and mushed them together, and that doesn't work so well. You need to have the ability to have a process of putting things together. And one of the very important points from my perspective is that practitioners, Chinese medicine practitioners, I also believe that any practitioner should be well-versed in issues such as drug-herb interactions. And there was a little bit of discussion about this earlier. However, this would mean so that you can be secure, and I can be secure, and the Western team can be secure in the healthcare that's going to be combining Western and Eastern remedies. So one of the things that Josh was talking about earlier is that you have to be able to put things together in a way that's safe as well as effective. So here's examples of integrating, I don't know if, oh, I guess you can see that. Integrating Chinese medicine with Western care and cancer support. So I'm just going to use, where's the button? I'm not sure. Oh, well. It's okay. So basically, for people who have cancer and are undergoing chemotherapy or other Western cancer options, basically our focus is to minimize the adverse effects of chemotherapy or other treatments, such as fatigue, which is actually, I understand, is one of the main symptoms that people diagnosed with NET experience is fatigue, and then there's a number of other symptoms that come from various medications and from surgery. Also, preparing the body for surgery. So if somebody is going to be going through surgery, preparing the body for surgery, managing pain, support, proper recovery afterwards. Acupuncture is very specific for helping that, and I'm sure that a number of you have experienced acupuncture specifically for that purpose. So co-management would also mean, and this is something you want to work with your practitioner to develop, means scheduling acupuncture at the optimal times around your Western therapies for the best impact. Recommending herbal strategies that will be supportive and safe, as I already mentioned. And then, if somebody has cancer or is not currently undergoing Western care options, you know, watch and wait, or a person is no longer going through treatment, is supporting the proper function of the body's immune system from the Chinese medical perspective. And this is actually something I think needs more research, needs more work within a Western research setting, as well as to start looking at the way that the immune system can be supported very specifically in various types of cancer using Chinese medicine. Also maximizing the overall physiological balance from a Chinese medical perspective, and support the spirit, called Shen in Chinese medicine. So the co-management would be working with the Western provider to monitor the stage of health and or disease, and also making referrals for second opinions, support resources, making referrals to other practitioners. If, for example, somebody comes into our clinic but does not live in the Bay Area, we can make referrals to practitioners in their area as well and be able to have communication that's going on. So what do we say to people with cancer or who have had cancer treatment, now seeking integrative care? Our partner is you. That's the first partner, is you, the client. And we're, you know, I say we're not here to fix you, but we're here to support you on your journey to better health. You are the captain. You are the one in charge. I'm here to support you. And that's what I believe that that practitioners of Chinese medicine and other kind of integrative therapies should be doing. And if you're up for it, so are we. Second, we'll also partner with your Western providers where appropriate. For people who are diagnosed with cancer, we work with oncologists, and we work with oncologists throughout the Bay Area and sometimes outside of the Bay Area as well. And I think that we also say that we will collaborate with your Western and other healthcare providers as appropriate. It's important that there be sharing of lab work, treatment plans, so that everybody's on the same page. And that's a very important part. I'm very clear that I want to see your labs as soon as you come in. I want to keep following your labs. I want to see your scans. I want to see all the reports and work with the providers. And it's, in terms of a Chinese medicine consultation, it's best that prior to a face-to-face meeting that your practitioner has all of the information and has reviewed the relevant health information. I also believe that, that a person who's coming into the clinic should write a narrative or have a detailed narrative. I like to review that because I get much better sense of what's going on with the person with the narrative and not have to ask all those questions during the course of treatment and can just sit there and focus with the person on exactly what it is that they need at the moment of coming in for treatment. At the consultation, the practitioner will discuss the health history with the patient, should also be asking questions, feeling the pulse, looking at the tongue, and coming up with a Chinese medicine diagnosis. And at the end of the consultation session, there should be a treatment strategy that is developed, and then a tailored comprehensive treatment plan that can be developed. So this plan should reinforce the Chinese diagnosis, should help with develop a recommended treatment plan, and then the steps for facilitating the client's own health. So a person who's coming to the clinic can go to a specialized, or to any person who's been diagnosed, can go to a specialized integrative Chinese medicine clinic for acupuncture, for nutrition, for herbal follow-up and monitoring. Also, people who've been referred or have a referring practitioner with a treatment plan, the treatment should be able to be carried out by the referring practitioner. And treatment plans should be updated periodically. Comprehensive treatment plans can be developed and can create a structure around the client. You want to know where you came from and where you're going. And that's what the treatment plan strategy is about. Should include the practitioner recommendations in the treatment plan. Again, individualized therapy is important, and I think this is a really common theme, I think, in general here is individualized therapy. And in Chinese medicine, it would be the same. Acupuncture, herbs, diet, exercise, massage, and other referrals. And the plan should account for the Western diagnosis, the Chinese diagnosis, and all of the personalized considerations. And the practitioner, most importantly, should care what you, as the person who is coming in for help, cares about. That's the most important thing. What you care about, and also what can you respond to emotionally, physically, financially is also very important. So how do you engage your team in your total care? These are the points that I want to leave you with. One, if you can write a complete narrative prior to seeing your practitioners east or west, I know some of your doctors are going to, oh no, they came back again with all that stuff that they wrote down. Well, you are going to have the best ability to be able to communicate with your practitioner. So I want a practitioner who I see to actually read that and say, hey, you know, this is what you had to say, now tell me what's going on today. Provide a list of all, this is very important, to provide a list of all the substances, the timing and doses that you're taking, and have that prepared for your practitioner. Provide all pertinent medical records, labs. Introduce your practitioners to each other and say, hey, look, this is who I'm working with, I want you to be my team. Share the information and treatment plans among the practitioners, the caregivers, everyone together. And if you can do that, that's going to help you not just through treatment, but through a lifelong ability to be able to take care of yourself. And there's lots of other things, but I'm sure we can talk about it afterwards. Thank you.
Okay, our last speaker in this segment, and then we're going to ask all these speakers to stay here, and the rest of the faculty come up. We'll go right into your questions, is Angela Laffin, who works as a nurse practitioner in the field of oncology here at Stanford. She's going to talk about survivorship with a particular focus on fatigue.
Thank you. Okay, great. Thank you. It's wonderful to be here and to see some familiar faces in the audience. And it also seems appropriate to end the day talking about survivorship. I just wanted to start by discussing what we mean when we use the terms cancer survivor and cancer survivorship. Cancer survivorship is defined as living with, through, and beyond cancer. And a cancer survivor is defined as anyone living with cancer from the date of diagnosis to the end of their life. So all of you here today, regardless of what part of your cancer journey you're on, are all cancer survivors. The field of survivorship is evolving, and there are many organisations that are focusing resources on developing guidelines to help us understand issues of survivorship and how to manage them. And some examples of those are the National Comprehensive Cancer Network, which is an organisation which is made up of about 25 of the world's leading institutions, one of which is Stanford, and they focus on developing guidelines for management of cancer, but with regard to survivorship, development of survivorship guidelines. The Oncology Nursing Society, of which many of your oncology nurses would be members, and the American Society of Clinical Oncology, which your oncologists would be members of. And the issues that these organisations are looking at are, these are an example of some of them, so cognitive impairment, the changes that patients describe to us that they have with the cancer diagnosis, and often patients refer to that as chemo brain. Anxiety and distress, of which I'm sure all of you can relate to on some level. Fertility and sexuality, something that probably as healthcare providers we could do better at discussing with our patients. Sleep disorders, management of pain, exercise and recommendations for exercise during treatment and with a cancer diagnosis, and fatigue. And so, as I said, survivorship begins at the time of diagnosis. So, as patients, I think you should feel empowered to discuss these issues with your oncology team, if they're not already being discussed, and to seek appropriate referrals if they're relevant to you. So, as you know, neuroendocrine tumours are rare, and so the impact of neuroendocrine tumours on survivorship issues has not been well documented, but I'd like to draw your attention to this survey that was done, and the poster, as Ron said, is out in the foyer, and this was a collaboration between the International Neuroendocrine Cancer Alliance and Novartis, and it looked at the impact of a neuroendocrine diagnosis on quality of life. And some of the results showed that 71% of patients said that a diagnosis of neuroendocrine tumours had a significantly negative impact on their life. 92% of patients had to make lifestyle changes, and 40% of patients experienced general fatigue, muscle fatigue, and weakness on a daily basis. So I just wanted to spend a few minutes talking about cancer-related fatigue, and once again, I'm sure this is something that you can all relate to at some level. Cancer-related fatigue is diagnosed as a distressing, persistent, subjective sense of physical, emotional, and/or cognitive tiredness or exhaustion related to cancer or cancer treatments, and it's not proportional to recent activity, and it usually interferes with usual functioning. So this is often a very distressing symptom for patients, and it's often not relieved by sleep or rest. So when we work with patients, as healthcare providers, when we're working with patients to help manage cancer-related fatigue, the things that we think about are, is this related to the cancer itself? And we know, as Kari said, that fatigue is often something that people present with. And we don't have a clear understanding of why people feel so fatigued with a cancer diagnosis, but we certainly know that it's true. So helping treat the underlying cancer is important. And there's also, with that treatment, the medications that we use have cause fatigue as well. So chemotherapy, biologic agents like Afinitor pain medications, medications for anxiety or nausea, all of those can cause fatigue as well. Anemia, which is lowering of the red blood cells, can cause fatigue. So looking at the management of anemia and also assessing vital organs, whether there's been any change in liver function, kidney function, and we monitor that through the blood tests that we ask you to all have very regularly. And also looking at the heart with Carcinoid syndrome, we know that people can have changes in the valves in their heart, and that can lead to fatigue. Other causes of fatigue I've represented here in this pie graph because they're all so intertwined. Sleep. If we don't get enough sleep, obviously that will affect our energy levels. And sleep disturbances can be caused from numerous reasons. Some of the recommendations for managing sleep disturbances, some very basic ones, are to have a good sleep routine. Go to bed at the same time every day, get up at the same time, use the bedroom just for sleeping and sex, no screens in the bedroom, which we all tend to have some sort of screen by our bed, but limiting the amount of screens and having a relaxing bedtime ritual seem to help with sleep. Obviously, if we are in pain, we're not going to sleep well, and poor pain management or pain control certainly can lead to changes in our energy and lead to fatigue. So making sure that we're managing pain, and chronic pain really is best addressed using sort of a multidisciplinary approach, pain medications, other modalities such as cognitive behavioural therapy or mindfulness meditation, referring to a psychiatrist or therapist, and sometimes using antidepressants as well. And obviously we're not going to be able to exercise very well if we're in pain. Exercise, we know there's more and more research showing that you need to exercise to help with cancer-related fatigue. It's fine to exercise when you have a cancer diagnosis, and it's okay to exercise while you're receiving treatment. The recommendations for exercise are 30 minutes a day, 5 days a week, which for some people is a lot, and you need to work up to that. 2 suggestions on working up to that. Number 1 is to have a routine, and number 2, to have a buddy, someone who is going to be your exercise coach who can help you get motivated each day to go for a walk, even when you're not feeling like it, because it's certainly counterintuitive to exercise when you've got fatigue, but it's very important. Obviously, for exercise, you need to have some fuel in your tank, so focusing on nutrition, making sure you're getting enough caloric intake, making sure that you are not dehydrated, and certainly with people who have carcinoid syndrome and have a lot of diarrhea, it's important to make sure that you're well hydrated and that your electrolytes are all in balance. And then also focusing on any mood changes. As you've heard from Dr. Kogan and Nicole, mood changes are a very normal consequence of a diagnosis, and part of those mood changes can lead to fatigue. So seeking appropriate referral to practitioners who can help manage any of those mood changes certainly can help manage fatigue. A patient asked me this week, he was complaining that he was tired, and should he be exercising or should he be conserving his energy? So what we discussed was, yes, he should be exercising, because as I said, exercise is really important for the management of cancer-related fatigue. But he also should try, in his normal daily life, try and preserve some of his energy. And this comes back to a lot of what Kari said. So think about in your day, plan your day, and have it organised. So make sure you know what you want to do each day, organise it so you don't have to rush. Plan on switching between low energy and high energy tasks, and allowing people to help you. Pace yourself on those really high energy days. People definitely, it's easy for them to just go at it and do everything that they want to do, and as Kari said, then they end up paying for it for the next few days. So pace yourself on good days and bad days. Positioning, so using assistive devices, so for example a grab bar in the bathroom, or when you're doing normal daily activities such as folding the laundry or preparing meals, washing dishes, maybe prop yourself up on a stool so that you're not standing and you're conserving some energy that way. And prioritising, so working out what you want to do each day, be realistic with your goals, and making sure that what you're doing each day is something that you really enjoy, that you get pleasure from, and that you make each day count. Thank you.